Hi, my name is Audrey Clairman. I'm in THF 100 Anatomy and Lifestyles at Ryerson University, and today I'm going to be taking you through my personal warm-up exercises that aim to target 4 main troublesome areas of my body that I'd like to improve upon, not only just for my body's sake, but also for my physical self and physical presence as an aspiring actress. My warm-up deals with areas of release and stability, flexibility and stability, as well as some alignment techniques. The warm-up, whether it's preceding a big rehearsal or performance, or if it's just commencing a movement class, has to be done with great precision and attention to detail. Lots of focus and concentration, and hopefully quite a bit of relaxation as well. The objective of my personal warm-up as an actor is to get my body responsive and alive and sensitive so that I have an instrument that's prepared for the demands that are to follow. The warm-up is not designed so that I can spike up my energy or get my heart rate going or start sweating a lot. It's just so that I can target the areas of my body that I find the most tension in and that I find the most difficult to get moving when I'm on stage. The first set of exercises in my warm-up targets the groin area, so the adductors along the inner upper thigh. I want to try to find release in my adductors, as well as also finding stabilization and still a lot of rotary ability in my lateral hip flexors and along the outsides of my hips. In this exercise, I'm going to bring the soles of my feet together, pull them in towards my pelvic bowl as much as possible. Then I will link my fingers together and bring my arms around my legs such that the inner bend of my elbows is at my patellars. So I'm going to breathe in deeply. On the exhale, I want my legs to fall gently open so that they are pressing against my elbows a bit. Now I want to use gentle force when I'm doing this because I want to feel a released, not strengthened stretch within my adductors, but I still am getting some strength within my lateral hip rotators deep to the glutes. I will repeat this exercise for 3 breaths. In this exercise, my heels are in line with my glutes. I want to make sure that my hips are flexed only to 45 degrees and my knees are flexed to 9 degrees. My abdominals are engaged with the neutral pelvis as I abduct my top leg. Here I resemble an open clamshell. My feet remain in contact throughout this exercise, and I repeat it 8 to 10 times, lying on either side. It helps to enable rotary stability on the lateral sides of my hips while restoring length and flexibility to my adductors. In this advanced clam exercise, it's just my knees that are making contact with the floor so that my legs are up to a 45-degree angle. From this lifted position, I abduct the top leg, pause at the top, and with control, I lower the top leg. Again, my feet remain in contact the entire time, and I'm going to repeat the exercise 8 to 10 times, lying on each side, targeting the same muscles that I talked about previously in the last clam exercise. In this exercise, I'm on all fours, hands directly under my shoulders and knees over my hips. My abdominals are engaged, and I lift my leg up and out, maintaining a 90 degrees of hip flexion and knee flexion. I must avoid rotating my hips or arching my back as I lift the leg. The goal is to lift the thigh to the level of the torso so that I strengthen the lateral hip and stretch and open the adductors. The foot is flexed the entire time, and I will do this 8 to 10 times on either leg. Due to several ankle sprains that I have had while playing soccer growing up, my right ankle has become considerably weaker than my left. So in my warm-up, I'm going to do a couple exercises that strengthen my right ankle. With a resistance band around my affected ankle, I'm going to switch from eversion and inversion in order to try and strengthen the ankle. I will do this about 10 to 15 times, ensuring that my foot stays relatively in dorsiflexion and that my leg does not rotate as I do the exercise. Now I will be moving on to some lumbar, spine stabilization, and alignment exercises. First in this exercise, I'm going to check my neutral spine alignment, pubic bone in line with navel, sacrum, and nose. I want to stand equally on the 3 points of my feet, big toe joint, baby toe joint, and the calcaneus. I'm going to do a roll down to ensure that I feel all the vertebrae in my spine, especially in the lower back. When I step over the towel with my left foot, I want to keep my knees released. The goal is to keep the lumbar spine and sacrum neutralized and stable as you bring the right foot into proper parallel alignment, again balancing both feet on the 3 main points of contact. Repeat, going back in the opposite direction with the right foot leading. Try not to look down at your foot for alignment, but rather feel the alignment based on the position of your lumbar spine in relation to the rest of your body. Again, repeating. Now, to challenge the lumbar stabilization even more so, step onto the towel with your left foot and bring your right foot up to rotire. Hollow out the core so that you feel the belly button to lumbar spine connection to stabilize you. Recover. Then step over the towel with the left foot. Get alignment in your feet. And repeat the towel part with the right foot leading. The exercise will continue for 2 minutes. I begin lying on the floor with my natural curve in my lumbar spine, both feet propped up on the exercise ball with my arms relaxed to the side. It helps to think of my sacrum as a wide and weighted triangle. I inhale. On the exhale, I hollow out my core to activate my lower abdomen muscles, and as I do so, I tighten my glute muscles to lift the buttocks off the floor 2 to 3 inches. I peel back down through each vertebrae of my lumbar spine to feel each one's connection with the floor. Repeating again. When I lift, I want to be resting on the lowest vertebrae of my thoracic spine. I repeat this exercise 5 full times. My body starts around the exercise ball. I extend my legs out into a plank-like position, staying on the balls of the feet, and then my arms extend out and forwards into a Superman-like position. I must try to keep width between my shoulders and ears. Now I recover, and I will show you it again. Now watching for it this time, the importance of this exercise is to keep the lumbar vertebrae stabilized in a normal alignment, meaning not too much forward flexion, backward extension, or any side bending. I will repeat this exercise 5 full times. I'm going to finish with doing an exercise that stabilizes the rotator cuff muscles that are on my scapula because of the damage that I've done while swimming, so that will help. And then to make sure that both sides of my body are in balance, I'm going to follow that up with 2 exercises that really open up my pectoral muscles along the chest. The Hitchhiker exercise. My arms are straight out to my sides with my thumbs pointing to the ceiling, and my head is in line with my spine. While squeezing the shoulder blades together, I lift my hands up off the floor and move them slightly towards my head. I must use both shoulders at the same time. I should end up in a position that looks like a Y at the end of the exercise, and I hold it for 1 to 2 seconds, and then relax to the starting position, and repeat. This exercise engages the upper back by depressing my scapula and laterally rotating the rotator cuff muscles so that the pectoral muscles do not take over. I will perform this exercise for 2 minutes. Begin in downward facing dog position. On an inhalation, come forward into plank. On an exhalation, bend at the elbows and slowly lower yourself down to the floor, remaining lengthened through the entire spine. Roll your shoulders back and gently press your elbows in so that they're facing behind you, hands just underneath the armpits, torso distance apart. Reach back through your legs, press down through your palms, and slowly send your chest forward and up. Keep the back of your neck long as you continue to broaden your chest and open the pectorals. Roll your shoulders back and down into retraction when in this cobra pose. Repeat 5
Place the hands
palms together in front of the navel. Inhale, fan your arms out, palms facing upwards, lifting the chest, finding width and release across the chest. Shoulders and head are back. Exhale and bring the hands together again. Inhale and repeat, lifting the chest. Focus on allowing the breath to drop as deep into the pelvis as possible on the exhale. Repeat for 5 full cleansing breaths.